In this video, the Center for Teaching at the University of Veterinary Medicine Hannover will demonstrate the placement of a simple continuous suture. This video will focus on the technique of the suture. When placing continuous sutures, a single thread is used to create a stitch across the entirety of the wound. For this, a beginning and ending knot are required for each suture. Continuous sutures have multiple advantages, such as a quicker application and an even wound adaptation. Furthermore, continuous sutures are gentler on the surrounding tissue. This, however, comes with the risk of the entire wound opening if only a single knot fails. Irregular wound shapes also make the placement of continuous sutures more difficult. When placing continuous sutures, the stitch should begin on the side of the suturing hand. The simple continuous suture is especially well suited for the adaptation of fine, elastic tissue. It is commonly used on the linea alba of cattle or horses, as well as the musculus obliquus externus abdominis of cattle after the operation of the abomasum. A further use case would be on skin wounds of horses, which has unique parameters. Normally, the beginning and ending knots are placed outside of the wound gap. A cutaneous suture, however, is placed inside the wound gap itself. This technique provides a high amount of stability, though causing prominent scarring. Needed for the skills lab exercise are a needle holder, a pair of surgical scissors, anatomical forceps, as well as the required suture pad. These simulate either the peritoneum or the skin. Gloves and an appropriate needle and thread combination are also required. When working with a patient, absorbable suture material should be chosen for internal procedures, while a monofile, non-absorbable material is used for skin sutures. The needle and thread combination contains an atraumatic needle without an eyelet. Instead, the thread is connected to the needle directly. This allows for a smoother perforation of the tissue when driving the needle, causing less of a reaction. Therefore, an atraumatic needle is better suited for finer, more fragile tissue such as internal organs, blood vessels, or the skin. In contrast, traumatic needles are separate from their thread. The needle's eyelet must be threaded before use. This eyelet and thread create a double perforation of the tissue when the needle is driven through, creating a stronger reaction. Traumatic needles should only be used on more robust tissue, such as muscle or fascia. A few general notes for the procedure. This video primarily focuses on the suture technique. Therefore, there will be no mention of placement or number of knots, since these parameters are highly variable and depend on the species, the individual patient, as well as the state of the tissue itself, and whether it is the beginning or end of the suture. When suturing, the needle is only ever held using instruments. It is vital that the needle's tip is never grasped, as this quickly leads to blunting. Furthermore, the thread should only ever be pulled on with fingers. No instruments are used for this. The needle holder with fixated needle is held in the dominant hand, with the remaining thread collected in the palm. A right-handed suture will be demonstrated here, subsequently beginning on the right side of the wound. In the first step, a simple suture is placed into intact tissue outside the wound gap. For this, the tissue on the edge of the wound is lifted with forceps and the needle is driven into and out of the tissue in one motion. Each end of the thread can now be secured with a surgical knot. It is also possible to utilize a slip knot here. Finally, the beginning of the thread can be shortened to one scissors blade's width. Following this, the needle is driven perpendicular to the wound gap, always beginning outside on the same side and going into the wound. The wound edge can be lifted with forceps, and the needle is driven from the outside inwards through the tissue. The needle is then grasped with the forceps, and the middle to lower third is placed back into the needle holder. It is important to fixate the needle in the position as it will be required for the following step. Next, the opposing side of the wound can be grasped and lifted with the forceps, and the needle is driven from the inside out. These steps are continued for the entire length of the wound. After every stitch, the tissue is compressed without endangering fingers, or with the help of a swab. This ideally leaves the thread under constant tension and provides a tight wound closure. The suture is finished with a simple interrupted suture, outside of the wound gap. It is important to leave the final bridge before ending the suture as a loop, as this will be used in the closing knot. The thread and loop can then be shortened to 1 scissors blade's width. Finally, the suture's closure can be inspected. The utilization of a simple continuous suture for skin wounds of horses differs slightly, which is why the procedure will be demonstrated separately here. In the first step, the wound gap can be lifted with forceps. This provides a view onto the different layers of the skin. Starting at the top, these consist of the cutis, subcutis in red, as well as the fascia and muscle in white. In this procedure, the needle will only perforate the cutis and subcutis. A further unique parameter is that the beginning and ending knots for the simple continuous suture are placed in the skin at the wound edge, not outside of it. Furthermore, it is important to make sure that the thread ends of the beginning and ending knots are left longer when placing on horses. They should have a length of around 2 centimeters. Besides these details, the placement of the simple continuous suture is identical to the technique previously demonstrated.